these are this is interesting because there are conflicting results. There were some studies saying that this risk is increased, but actually, if you look closely at the different types of populations, you also could consider that those are maybe risk populations with other risk factors in other age groups, and then you have to say it's menopausal, postmenopausal, and the older the included patients are, the more ischemic strokes others you have. What we find is actually a slight increased risk when you take, and then the hormonal treatment is quite complex, so it's depending on the dosage. But if you take the normal estrogen progesterone mixture, you could say it's slightly increased, but it's not so significantly increased that you should avoid it. Concluded, and this is the point because we were just considering in the stroke risk of ischemic stroke risk and the intracerebral bleeding risk, that we cannot recommend for avoiding a stroke treating patients with hormonal treatment. So this means, if you know, the interpretation is that if you have a woman with a vascular risk factor profile that is at high risk for stroke, you should avoid giving it. But more we can't conclude. This is kind of tricky. For some studies had a lower, but considering all in the meta-analysis and the voice box, it was 1.1, 1.2, so it was a slight increase for ischemic stroke and not hemorrhagic stroke. So you should be careful and control the risk factors in this woman.